straight away come to Madam Vice Chancellor. Kindly introduce yourself to us, and after that, you'll answer the following question, which is what is the significance and scope of MAST's collaboration with UK research and academic institutions?
Thank you, Gloria. So I'm Professor Pauline Biachika Chibwika. I'm the Vice Chancellor of Mbarara University of Science and Technology. I'm a professor of internal medicine and epidemiology. So MAST's UK collaborations are mostly postgraduate collaborations. So involving mostly students taking on postgraduate training, master's, PhD, and postdoc training. And of the collaborations and partnerships that we have with UK, the institutions include the Association of Commonwealth Universities that offers scholarships to MAST staff and alumni. We have the Royal College of Emergency Medicine that supports the Department of Emergency Medicine, where Daniel is from. We have the Royal Academy of Engineering that collaborates with the Faculty of Applied Sciences and Technology. The University of Southampton has exchange programs with the Department of Physiology. The Darwin Initiative and International Institute of Environment and Development that conducts research about conserving the environment in protected areas in southwestern Uganda. Then we have the London School of Hygiene and Tropical Medicine, the University of Edinburgh, Bristol Eye Hospital, and Moorfields Eye Hospital that collaborate with the Department of Ophthalmology. And the University of East Anglia under their School of International Development Partners that collaborate with the MAST Faculty of Interdisciplinary Studies. So these collaborations are all very important to us to emphasize the significance in terms of the multiplier effect it has, because it's difficult for us to send several people over to the UK to train. But once one or two people go over to train, they come back and train several others. So that is a very significant contribution to MAST and to Uganda as a country. But also the research partnerships are very important because, you know, we are a University of Science and Technology. And as a university, our major role is training, research, and community engagement. And these partnerships facilitate us to carry on our mandate of training, research, and community engagement.
How are you looking to sustain these gains made after expiry of the projects, and what is the extent of local collaboration with other Ugandan universities and ministries to ensure that the gains from these projects get to benefit the rest?
We want to thank our government of Uganda because we are seeing more funding for research and innovation. So through the knowledge we gain from these partnerships, we still bring it back home, and through our funding from government of Uganda, we're able to continue with our research projects as a university. So we are hopeful that the government of Uganda will continue to fund our research projects so that we can have continuity of the work that we will have started with our partners from abroad. Thank you very much.
Thank you very much. And this brings us finally to, I think, the last question. As a country, how do you think we can further harness the relationship with the UK to strengthen Uganda's expertise in the areas of learning?
I'm saying we need to strengthen by increasing opportunities both ways. Here locally for them to learn from, and abroad for them, giving us opportunities also to learn from them. We are seeing from the US government the funding cuts. So as a country, we need to increase our own funding, our resources to fund this work, as we also look to our partners to continue funding our work, so that once they see that we also have some effort in funding ourselves.
Thank you. Working with the Royal College of Emergency to address some of these gaps under the SCALE project. Kindly tell us more about the project.
Responding to the Royal College of Emergency Medicine, The training that started in 2017 was initiated by a fellow from the Royal College of Emergency Medicine, that is UK. So upon his retirement from Uganda, he returned to the UK and told them about the success story in initiating the program in emergency medicine. And this stirred up the interest in supporting the growth of emergency medicine and the emergency medicine care in the nation at large. Like I mentioned to you, the understanding is still ongoing, even from the grassroots. So with that, the Royal College of Emergency Medicine reached out to the Permanent Secretary and the Ministry of Health to see how they can actually help. So within this, we created a partnership and a memorandum of understanding that, like the Vice Chancellor had initially mentioned, has specialists and residents, those are the students doing the master's programs, have a bidirectional exchange. We send the specialists to benchmark and understand better how to train, and the residents go for observerships in the emergency departments so that they can come back and translate this understanding back to our nation. But we know these few people cannot accomplish the whole task. So there is a virtual platform where the specialists from UK engage with the specialists from Uganda to reach out to the community through the SCALE program. So this helps to strengthen the health workforce in the grassroots. I will understand how to stabilize someone who has gotten an accident so that they reach the hospital and they can get the appropriate care. So those are the arms that we are currently working on. The other is more British emergency medicine physicians are yet to come back to the country to continue supporting.
The Vice Chancellor to summarize everything by my last question in summary. What message do you have for the UK government? Right.
Thank you.
In summary.
Thank you very much, Gloria. Message for the UK government.
Yes.
First and foremost, I want to acknowledge the support they have given us over time and to thank them very much for the support that has contributed immensely to the training and research at Mbara University of Science and Technology, but also at for the country at large. You can see the products speak for themselves. Emergency medicine, Mbara University of Science and Technology is leading in training emergency medicine physicians